New numbers are revealing a trend downward when it comes to kids committed to youth facilities in the state. Our Tyler Thomason has more on the reason behind it. Well, in the fourth quarter of this year, 81 kids we know were committed to a youth facility here in the state. And last year, during that time, the total was 101. In the fourth quarter of the year before that, the total was 121. And these were some of the figures the Director of Youth Services presented to the Senate Committee on Youth today. He says it can be attributed to new individualized treatment plans for the children compared to in the past, which was described as a cookie cutter approach. The individualized treatment plans come from a risk assessment program that's used by the court system.
I really think they're doing a better job of using that tool to decide whether or not a child really needs to be committed to our custody and be behind a fence, typically in a residential setting, or whether they can receive those services in the community in a less restrictive environment.
When kids are brought into youth services, they're able to meet with clinicians and education specialists for a couple of weeks. Those staff members are then also doing follow-ups 1 to 3 months later. Another new element to youth services is the addition of a peer recovery specialist who helps the kids who battle drug addiction. And the specialist is a former drug addict herself who uses her own experience to relate to those kids on a similar level.